I want to know if splashing the cash makes a difference when the rich get seriously ill. There isn't a secret cupboard of expensive miracle drugs only the well-off can afford. But what if they could pay for a genetic test to find out which medicines would work best for them?
For every drug you can think of, your genetics handles the drug differently to my genetics. But it's not just which drugs are more effective, which drugs could hurt you.
The test comes with a £1,300 price tag.
We've tested probably about 100 patients so far. One was on an antidepressant. He wasn't doing that well. We found out the drug that he was on, he wasn't responsive to. So either the drug dose would have to be increased above the normal, or he'd be swapped to another drug.
It does always seem to be a conundrum to me that in many areas medicine is a very precise, rigorous discipline, and yet when it comes to prescribing drugs, it is a one-size-fits-all scattergun approach.
I hate population medicine in that we're treated as little clones. Everyone gets the same dose, the same types of medicine. We're not. We're all individuals with our own genetics, and that's why it's so important that we know what drugs should be used. Why wouldn't anyone want that kind of information?
The cost of genetic testing like this is rapidly coming down, so in time, I hope this will become routine.
I am so completely sold on the idea of using genetics to make prescribing medicine safer and more effective that I'm going to do the test myself, and all it involves is a little cheek swab.
Next, how the rich are trying to cheat death altogether.
And we're saying when we call someone dead today, they're really not.
The very richest are pulling away from the poorest in terms of life expectancy, and experts predict that this gap is only going to get wider. I'm trying to find out whether costly tests and treatments accessible only to the wealthiest are helping them achieve their longer lives. At Chase Lodge Hospital, the results of my gene test are back. As well as looking at how my body responds to various medicines, the test also looks at some risk factors related to stroke and heart disease.
Tell me.
Let's get stuck in. So you seem to have an increased risk of thrombosis or clot in your body, and you also have quite a high increased risk of a certain chemical called homocysteine, which increases, again, clots in your veins. Now, does that have any significance to you in your medical history?
So that's a double whammy of clotting.
It is, actually.
Actually, that is interesting. My father, has had clot in his legs.
Right.
And he's also had clot in his lungs.
OK.
So, guess who I got those genes from
Exactly.
then?
And by knowing this information, we can prevent what happened to your dad happening to you.
So what sort of things would I need to do?
So, for example, let's say we wanted to put you on a blood thinner. Let's go and have a look which blood thinners. And here we go. Now,
So
interestingly...
things I might need were I to develop one of these clots?
Exactly. One of the common ones you cannot use. Not that it would hurt you, you wouldn't respond to it. So you'd be falsely reassured and you would still be at risk of getting clots. So,
Oh, great. So I've got a double clot risk.
Yep.
And the most common drug won't work.
And you would think, and your doctor would think, that you are covered.
And we would have no other way of knowing that?
No, not at all.
So it
As
would
we-
leave me at high risk of clots?
Yes.
It's shocking to hear what could kill me, but I now have a valuable piece of information that could save my life. And it's become abundantly clear to me that this is, or should be, the future of medicine. The test already exists and will allow doctors to prescribe with a far greater degree of accuracy and safety. And although it may seem expensive, it will actually save us millions in the long term.